Welcome back to What's Now. This episode all about your health. With the pandemic, health has been the top of the list, and unfortunately, heart failure is a leading cause of death right here in this country. Let's find out more about that right now.
About 1 million people are hospitalized in this country every year with chronic heart failure. That's nearly 2 hospitalizations every minute. And as the pandemic continues, it's more important than ever for people living with heart failure to actively manage their condition to help reduce the risk of being admitted to the hospital. Here to discuss what everyone needs to know about heart failure is cardiac nurse practitioner Beth Davidson, along with Kim, who is living with heart failure. Thank you, both of you, for being here today.
Thank you so much for asking us.
Beth, what is heart failure and why is it important to talk about it now?
Well, heart failure is a chronic progressive condition that unfortunately can worsen over time. It can change the shape and function of your heart, making its ability to pump ineffective or not able to pump the blood efficiently to all parts of the body. When that happens, over time, patients will develop significant symptoms, such as fatigue or being tired or shortness of breath. They'll hold on to fluid in their legs, their abdomen, or their feet, so they'll get all this swelling. And when these symptoms get worse enough, patients come to the emergency room or the hospital for relief. So we bring them into the hospital, we give them medications to clear the fluid, we send them home, but unfortunately, it's a bit of a vicious cycle. So 25% of those patients actually come back to the hospital within 30 days for similar symptoms. So it's quite a burden on the patient, the caregiver, and the healthcare delivery system. And clearly we're living in the unprecedented times with the COVID-19 pandemic, and healthcare resources are already stretched. So in light of that and the fact that these patients are already at risk for hospitalization, we're trying to do everything we can to minimize that risk and keep patients safe and at home.
Kim, tell us about your diagnosis and your experience with heart failure.
At the age of 32, I developed some symptoms. I had a cough, I couldn't breathe, I couldn't lay down flat. For about 6 months, my doctor tried to treat me. He could not figure out what the problem was, so he sent me to a lung specialist who had me admitted to the hospital. I spent 3 days in a coma and 48 days in the hospital. When I was dismissed, I was told I had chronic heart failure with 5 years to live. So that was my initial experience with it.
Gosh, so young to have to be dealing with this. Beth, how can people manage heart failure, and what are you telling your patients during this time?
Well, despite that it's a chronic condition with repeat hospitalizations like Kim experienced, we do want patients to know if they're an active participant and follow, a heart-healthy lifestyle, stay active, stay in touch with their team, follow a low-salt diet, and take their medications as prescribed, their trajectory or their course, so to speak, is so much easier. So Kim and I are both here on behalf of Novartis to talk about heart failure, but specifically a very effective medication for adults with chronic heart failure that we know as Entresto. And it was really exciting in the heart failure community that this medication got an expanded indication in February. So now it's available for more patients with chronic heart failure than ever before. Now, it'll help keep patients out of the hospital. It'll also help reduce the risk of death. And it works best when the heart isn't an efficient or an effective pump. But like all medications, it's not right for everyone. There are some risks and there are some side effects. So if you're pregnant or taking a class of medications known as an ACE or an ARB or aliskiren, this is not the right medication for you. If you've had angioedema, which is a very severe allergic reaction where your face, your mouth, and your throat swell while you're on an ACE or an ARB, this is not the right medication for you. It's really important for your listeners to know to talk to their healthcare team about changes in their symptoms, if they've had a heart failure hospitalization, and to see if this medication makes sense for them at this time.
Kim, how are you doing today, and how do you manage your heart failure?
To a day, I am on the medication that Beth mentioned, so that has kept me out of the hospital. But everyone's experience is different. I'm very active. I spend time with my grandbabies. I swim. I have a very healthy lifestyle. I eat healthy. I stay in good contact with my doctors, and I am my own advocate.
Where can we get more information, Beth, and learn about heart failure and managing the condition?
Yeah, there's a lot of things that patients have access to that may not be accurate. So we definitely want to send patients to websites where we know it's current, it's accurate, and it's up to date. One of the websites that I send my patients to is Entresto.com. There's a lot of information on there, including just heart failure in general, risk factors, signs and symptoms, how we diagnose it, medications we use to treat it, and some of those safety information that I mentioned previously.
Well, thank you so much, Beth Davidson and Kim, for joining us today. We appreciate you presenting this information. And Kim, thanks for your honesty and vulnerability and sharing your experience with heart failure.
Thank you.
Thank you so much.
Thanks for watching this episode of What's Now. We appreciate you being here and your support. And if it's important to you, it's important to us right here in our studios. I'm your host, Christine Napier. We'll see you next time.